Hi, and welcome to the Beginner's Guide to Advanced Directives. I'm Kelly Welton. This is actually the short version of this talk. I have the full version of this in my COPD Success program. I just wanted to do a quick short version today for people who are not real familiar with advanced directives, living wills, durable power of attorney of healthcare, etc. I've been a respiratory therapist for 32 years, and I've seen quite a lot go on revolving around advanced directives, or more specifically around not having one. And a question that I get asked quite frequently is, when am I going to talk about this? No one wants to talk about it. Every time I bring it up, people say, oh, no, I don't want to talk about that. No, no, no. But keep trying. Just let somebody know, I want to talk about this. It's very important to me. I need about 10 minutes of your time. Eventually, you'll find someone. Very important conversation to have. So questions that I get asked are, if I have a living will, do I also need an advance directive? So I just wanted to go over the differences between a couple of documents. So a durable power of attorney for healthcare appoints somebody to make all of the decisions. So if you land in the hospital, your durable power of attorney says you need to talk to my spouse, my daughter, my whoever. It just appoints somebody else to make all the decisions. Now, an advance directive is the document that outlines your wishes, that says you can do this to me, but you can't do that to me. I want to have this done. I do not want to have that done. And a living will outlines your wishes and also appoints somebody to make those decisions if you cannot. So in other words, let's say that you have outlined your wishes and something happens to you, you end up in the hospital. Somebody wants to clarify those decisions, you're unable to speak for yourself. It appoints somebody to help make those decisions if you cannot. So briefly, a living will, here's an example. I, so-and-so, being of sound mind, da 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 da. It's obviously written by a lawyer. What I don't like about this document is it's very vague. It doesn't really say you can do this, but you can't do that, or I want this, or I don't want that. It's just way too vague. So the way you get around that is, and you can add this onto your document, you can say yes or no to any of these treatments. And what I'd like you to do is pause the video for a minute and just have a look at these things, because these are things that go hand in hand with things that go on in the hospital. And just have a conversation. How do you really feel about each of these things? How do you feel about receiving blood? How do you feel about having to have surgery? How do you feel about invasive testing such as a cardiac catheterization? How do you feel about CPR, somebody doing compressions on you? How do you feel about having a tube down your throat and being on a ventilator? How do you feel about being on a BiPAP, which is a ventilator with a mask, not the tube down your throat? How do you feel about tube feedings, dialysis, IVs, antibiotics? Just take a minute and figure out, is this something you would want or something maybe you don't ever want? It's up to you. You get to say. Now here's an advanced directive sample. And I have the same problem with this document, is that it's very vague in that it says, if I at any time have an incurable or irreversible, that right there takes a long time to determine. And meanwhile, you could be in the hospital for days trying to figure out what's going on. It's just too vague. It just needs to be, here's the second page of it. It just needs to be a little bit more specific. You can do this, but you can't do that. So once you've got your wishes decided, what does it really all mean? What are you signing? Well, an advance directive, the good news is it's revocable. What that means is if you can say it, we can do it. And what I mean by that is, let's say you have an advance directive that says, do not do anything, DNR, which stands for do not resuscitate. Don't do anything to me. Don't take me to a hospital even. Keep me comfortable. But let's say you have an episode of really difficult breathing and you get to the emergency room and they say, you know what, your breathing's really bad. We want to put you on a ventilator. And you may decide, well, you know what? The rest of me feels pretty good. Today is just a heck of a day, having a hard time with my breathing. Okay, I'll go on a ventilator. We'll see what happens. So if you can say it, we can do it. If you come in the emergency room passed out, we have to honor your advance directive that says do not do anything. So the other part of this is saying yes to one thing often means you say yes to a lot of things that are connected. For example, if you put on your advanced directive, I want the ventilator, but I don't want any IVs and I don't want any feeding tubes. Well, once we have the tube down your throat on a ventilator, I need a way to hydrate you, get you fluids, and give you nutrition. So it's a good idea to have your advanced directive reviewed by somebody that can point out things that it would kind of be an impossibility, or it would be unfruitful, shall we say, if we did one thing and didn't follow another. If we intubated you, put you on a ventilator, but then we didn't give you any nutrition or fluids. So another thing, talking about ventilators, there's a machine out there called a BiPAP, and it's a ventilator, but we use it with a mask, not an endotracheal tube. It's still a ventilator, it's still life support. Oftentimes we do this for the family's benefit. When somebody comes in and they don't have an advanced directive, the patient's doing poorly, we're waiting for the family to come in. We do that to keep the patient going until the family can get there and all decide. But if you have an advanced directive, you can avoid all of that. And the BiPAP is not to be confused with an overnight BiPAP machine for people with sleep apnea. This is still bi-level positive airway pressure, but it's not at all the same as the hospital grade BiPAP machine. And I want to talk for a minute about what is the perioperative period. So the perioperative period, let's say you have to come in and have a surgery or a procedure done. You have to, heaven forbid, you break a hip or a knee, or you have to have a knee replacement surgery, something like that. If you have a pre-hospital DNR in place, or a pre-hospital or an advanced directive in place, during those procedures and surgeries, those documents get put away because they want your surgery to be successful. They want whatever procedure they're doing to be successful. And so the perioperative period is generally during the surgery or the procedure and the recovery time afterwards. So again, the DNR or any limitations get rescinded. There is something called an extended perioperative period where they really are very aggressive to try to make sure that the procedure was successful. So the question to ask is, after I have my hip replacement or my knee replacement or whatever I'm doing, when does my advanced directive kick back in? How long is that perioperative period? It's a very important question. I want to talk quickly about electronic medical records. Electronic medical records, they're a blessing and a nightmare. They're a blessing because I can look in and see your history and see where you've been and on all the things you've had done before. That's great. They're a nightmare because they're usually only on file with your local hospital. So you go out of town, something happens to you, they call 911, they take you to the closest hospital who doesn't have any information on you. And we've got to start over. So if I don't know you and you end up in my emergency room and I don't know anything about you and I don't know your advanced directive, I'm going to do everything I'm trained to do. So you want to make sure that when you have your advanced directive, you keep a copy with you. Gentlemen, you can keep a small copy or a card in your wallet that says, I have an advanced directive, and here's where you can find it. And the best place to keep it, besides in the glove compartment, in your purse, in your wallet, is at home, taped to your freezer door. That's where paramedics and emergency people will look, is on your freezer door, along with, please, a copy of all the medications that you are taking. That's always very helpful. So back to putting your advanced directive together, it's a very, very personal choice to live or to die. Some people have different definition of living, cultural and religious considerations. Just it's very important that you have an understanding of what is available, an understanding of your own physiology. If you have a chronic lung disease or a chronic kidney disease or a chronic heart disease, then standard treatments aren't going to work very well. You need to understand, what is your lung function capacity? What is your ejection fraction, your cardiac capacity? What is your kidney function? Important things. So thinking of those things, I wanted to go back to, how do you feel about each of these? And again, you can pause this video. How do you feel about having each of these things done? And the reason I do this is because I want you to also think about the quality of life. What does quality of life mean to you? Would you want to live on a ventilator? Would you want to live at home as long as possible? Would you want to live in a care facility? And most importantly, if you have solid answers to these questions, who could you trust to carry out those wishes for you? So briefly, I'll talk about what is DNR. DNR means do not resuscitate. Some people will choose a variation of DNR that says intubation only but no CPR. And that is an option. It's often chosen by people with asthma or COPD who feel like my heart is strong. I just feel like I need the breathing tube. Put me on a ventilator for a few days, let my lungs rest, let me get my strength back. That's a perfectly fine variation. Other variations are chemical code only, which means that we only give you epinephrine and atropine, but if I don't have any way to circulate those, they're not going to do you any good. So I really caution against chemical code only. And another thing you can put in is your use of BiPAP. You can say in your advanced directive, I do not want BiPAP. I do not want a mask on my face to try to breathe for me. Perfectly fine to say that. And what is a code blue? I just want to tell you quickly, a code blue is not like it looks like on TV. The doctor comes running to put the breathing tube in. The respiratory therapist is ventilating and helping get the tube in. The pharmacy, the nurse come. Someone does chest compressions. We attach a defibrillator. It all looks very, very chaotic. It's actually very well orchestrated when done correctly, but it looks very chaotic. And for that reason, I really discourage family members being present during a code. They look uh, very violent images that are hard to forget. Many family members afterwards are very shocked at just how chaotic it looks, even though it is ABC and 1, 2, 3 for those of us who do it every day. So that is the quick version of advanced directives. So what can you do? Make sure that you add lines for non-invasive positive pressure or BiPAP. Make sure you've said you can put a feeding tube in me or you can't. Make sure you include a well-defined perioperative period. My job is to educate the public on the amount and the extent of choices that you do have and the complications of each one. If you're bedridden, you might want to make provisions for bed sore care. So what else can you do? Go online. You can search for advanced directives forms for your state. They're specific to each state. You can discuss your wishes with your family members or anybody that will hear. You can appoint a family member. You can also appoint a neighbor, a friend. You can't appoint a healthcare giver. Just make sure everyone knows where to find this document when you've got it done. It's not locked in a safe deposit box. It's not locked in your attorney's office, that you have one on your person, in your car, taped to your freezer, somewhere where somebody can get at it. And if you'd like more information, you can visit us, please, at thebreathingspecialist.com or you can go to copdsuccess.com. Thanks for joining. We'll see you next time.